Do you care to share any success stories that you've seen?
I love these types of stories. I had a tough patient, right? She lived very hard on the office, a little bit hard to deal with, but I made that relationship with her. Now, I really wanted to get her across the finish line to get to peritoneal dialysis, which is a type of home dialysis for patients. It had a couple of barriers. So as a care manager, it's my job to find what are the barriers, how can we work through them. So speaking to her monthly, even if she's in a bad mood, I'm like, come on, just work with me. So I got her through that hump. We developed a relationship. Now she trusts me. So now it's go time, right? I have to make her vascular appointments. I have to make sure she actually gets her catheter for PD therapy placed. She can't drive herself. Her boyfriend is away. He is unable to drive her. She can't go anywhere. I have like 2 days that I can make appointments for her in the next 2 weeks for her to start the treatment so she doesn't wind up in the hospital, right? Mm-hmm. So I'm here making calls saying, okay, let's see who you can get to take you. She didn't want to wake up early. All of these crazy barriers, because this is what happens with our population. They come to denial. They don't understand that crashing in the hospital is a high possibility at this point. So I actually spoke to the boyfriend and I was like, you need to come down. You need to come take your girlfriend to her appointments. This is not, we can't prolong this any longer. And she actually called me. She was like, thank you so much for calling him and telling him that. And I was talking to the vascular surgeon's office pretty frequently too. So they saved her spot and we were able to get her in. And then she finally was able to start her treatment in 2 weeks. But I saw her again after in the office and she said to me, I wouldn't have done this. I would have ended up in the hospital because you took me across the line and I had the support. She wouldn't have on peritoneal dialysis today if we hadn't had that relationship early on. So I was working with her probably a year and a half prior to her starting dialysis. So I think that's really important to point out too. It's time, right? Yeah. It's not just something that patients can work with a month before they start dialysis or whatever critical condition any patient comes into. You need to have the support system, and that takes time to develop.
That's such a great example to really highlight how the first and foremost important thing in building this is just having a relationship with trust where they're going to listen to you. They want to engage. They feel that support because oftentimes patients don't necessarily know this is my barrier. This is a big problem. That isn't always there. And if someone doesn't know to tell you something, it's on care managers to almost be a bit of a detective of sorts. You have to use your relationship building skills to have the patient be forthcoming, to get some of those tidbits to figure out, all right, what's going to make the difference here? And I think your team does that really well, especially with a challenging group of patients.